Thank you very much for inviting me to speak today. APNA asked me to talk about this particular project that we set up in north central East London. And I'm just going to run over the reasons why we set it up and what's gone on and what's going to happen in the future. This bit of research I'm going to show you has been done by the King's Fund and was commissioned by North, as you can see, NHS London. And London in particular, I suppose like a lot of your cities, has particular problems and particular issues and particular solutions, we hope. London is a very diverse city, a very diverse population. It's a very young population, and it's very mobile as well. People move in and out of London very much. And it's mainly young people, because the families can't afford to live there. So basically, the young people are sharing flats and so on. So you get other health problems there as well. What also this particular piece of research showed was it's not all bad that's going on in London. Actually, smoking, the incidence of smoking compared to the other parts of England is actually lower in London than it is in other parts. But there's higher levels of obesity in children, a lot of teenage pregnancies. Suicides are higher in London than any other part of the country, and also teenage pregnancies. What we have is a diverse mix of general practices. You can see the figures here, but basically we have more single-handed GPs in London and also older GPs in London. There's, like other cities in the world, there's very poor populations, a lot of criminality in some of the areas of London, particularly on the outskirts, and not all GPs want to work there. So the GPs that are there have often come in the 1960s and 70s from other parts of the world, and they're still there. So very elderly population in the GPs themselves. And you wonder how up to date, dare I say it, they maintain. So they employ a lot of nurses, and we don't have SENs in the UK as you do, but we now have healthcare assistants. And it was interesting talking to somebody. I mean, we used to have SENs and then we got rid of them. And SENs, of course, are regulated. Healthcare assistants are not. But having said that, they give a real good support to general practice and give excellent care because of the training that they're given as well. From health outcomes, when we're looking at preventative health, there's particular issues in London as well. Obesity in children, I've mentioned, and that's something we're trying to work on, particularly at government level. But I was looking at the BBC News the other day to find that some of the shops, the major providers of children's clothes in the UK, are actually providing larger sizes for children. And also shoe sizes are much wider than they used to be 5 years ago. So they're catering, if you like, for the obese child, where we're trying to get rid of obesity in children. So it's all quite difficult. We're quite good on cervical screening and breast awareness, but also immunisation rates, don't you love that photo, are much lower than other parts of the country. And I guess that's because it's quite a transient population. What was that? Sorry, I thought somebody said something. But it's quite a transient population, so trying to actually, if you like, capture the babies and give them the full course of immunisations is quite difficult because they don't stay for long, often single parents and so on, so they move around, so you lose track of them. So there are particular issues in the cities. These particular issues that I'm talking about, do they translate to you and your cities? Yeah, so it's nothing unusual. And I suppose you have the same difficulties that we have, but it'd be interesting to talk to you about how you maybe solve some of these problems. So what we've been trying to do, because of the ageing population of the GP workforce, particularly the GPs themselves, but also nurses like me as well, what we have in the country is local education training boards, and they cover the whole of England. And what they do, they have amount of money from the Department of Health that goes into training all health workers, not only in general practice, but hospital and elsewhere in the health and social system as well. But they have dedicated pots of money for education and training. So what they decided in North Central East London, they were going to upskill a lot of the practice nurses in North Central East London to be at master's level, and also to develop nurse practitioners. So they would become the leaders in nursing in the area. So what we had to do was also talk to the universities to provide the courses that we wanted to upskill this group of nurses. So we did a lot of advertising, but what we also had to do, as well as getting the universities on board, and of course the universities were very keen to get on board, I mean it's more money in their pockets as well, was to get the practice managers and also the GPs themselves on board with this, because they were being paid to send their nurses to the universities and get the time off as well. But they also had to support the nurses and supervise them and so on. So they had to sign certain agreements, so we call them memorandums of understanding and learning agreements. And I must say, that has caused a bit of a problem. I mean, they signed these documents and sent them back, but whether they ever read them or not, I'm not 100% sure. So the aim was to increase the number of practice nurses at a higher level, but also to attract other nurses into general practice. That hasn't worked quite so well. So this is the number of nurses that applied for course places, and 62 nurses were actually placed on these courses. So that was a good percentage of all the nurses in North Central East London. And 25 nurses requested bachelor's level programs, because a lot of our nurses, like me, when I qualified as a registered nurse, we didn't do degrees then. So a lot of the nurses weren't at that level anyway, so we brought them up to that level. But the most of them wanted to do the master's level courses, and particularly in nurse practitioning. So that's where most of them have gone. What we've learned from this is what the universities wanted to do was to make sure those nurses who applied to go on the programmes were at an academic level where they were going to successfully achieve the programmes. And some of the nurses hadn't got the basic education to start with, whereby they could then go on and do the masters. So the universities had to develop interim courses that the nurses could do to bring them up to a level where they could successfully complete a 2-year academic programme to bring them up to master's level, most of them. And as I said, the aim was to try and recruit new nurses into general practice, where we didn't find that we did that. So the next phase is starting in September this year, and that will be looked at ways that we can attract more nurses into general practice. The other thing, of course, when you are training nurses, you need supervision and mentorship of these nurses and support them when they're doing their courses with the work they're doing in general practice. So each nurse had to be allocated a mentor, and we made sure that the mentors were trained as well. So they all had to have a mentorship qualification that was recognised by our Nursing and Midwifery Council. So we not only trained the nurses themselves, but we trained the mentors as well. And we followed them up to see how they were getting on and to make sure they were going to be successful in the programme. So the suggestions for the future are that we need to somehow engage the GPs and the practice managers more successfully, rather than just sending them a document to sign and send back to us. So that's something that is being worked on for the next phase. And funding made available for introductory courses, so those nurses that hadn't got the credits to be able to go on and do the master's courses, we could fund them to get that basic level first. And also attract new nurses into general practice, as I've said. So the idea and the ongoing evaluation of this is to develop nurses as leaders in general practice. I mean, practice nurses and nurse practitioners in the UK, I think, have been around 10, 15 years longer than you have, so maybe we're more established. But I always say we can't compare ourselves with you or another country because our health systems are different. Therefore, you develop in different ways and different rates. We develop networks as well, so these nurses are working together as they're doing the courses and looking what needs to be done to support the workforce and also to support the patient population. Because the whole idea of this, and we mustn't ever forget, is to improve the care of the patient and the patient population. We're also looking to change the workforce structure. And it's not all about a general practice, isn't just about GPs, it's the whole workforce. And in our situation, it's the practice nurses, nurse practitioners and healthcare assistants, which are the main clinical workforce as well as the GPs. And as I say, improving the health of the population. There were some little pictures through here, and I just wanted to finish off with this by saying I was in the dentist some years ago and picked up an old magazine, and there was an article, and the title of the article was said, "Take a Risk." Well, I think I maybe took it a step too far. But what the article was about was taking a risk in your workplace. So don't always go in your comfort zone, move out of the comfort zone. And just to reiterate this point with these, the picture over the far side there isn't a spider dangling from a thread. That's me abseiling down a 110-foot tower for charity a couple of weeks ago. That's me and Judy Evans climbing Kilimanjaro. When I emailed her and said, "Do you want to climb Kilimanjaro with me?" she just emailed back and said, "Yes, sure." She hadn't got a clue what Kilimanjaro was. And my husband, bless him, is trying to get rid of me, bought me the wing walking there. And I tell you, it's the best facelift you can ever get. And that was just cycling from Mount Cook to the ocean. But whenever you do anything, be it in the workplace or something completely bonkers like this as you get older, you have to work with experts. You don't know everything yourself. Work with other people, work with teams, take their advice, and basically don't say you can't do it. Thank you.